Well, to urologist Frank Glover, who returned from West Africa early this year, what do you think has to be done right now? Doctor, so good to have you. I know you've been swamped with requests and busy, period. Should we worry here?
Well, we shouldn't worry here, but we should be concerned and take this outbreak seriously because it is now, as the World Health Organization has already declared, an international public health emergency.
What makes it international? Just when you have incidents beyond the African continent, sir, that we have this case in Spain, we've had this case in a couple of other countries, but not to any large degree, and certainly nothing mimicking what we've seen in Africa. So hence some of those who disagree with you say, well, let's calm down. It's nothing approaching a contagion, or for that matter, something we need worry about.
Well, the Ebola outbreak is raging now, particularly in Liberia. And we know it has a 21-day incubation period. So a person could be infected with the Ebola virus and not know it for nearly 3 weeks. That person could board an airplane and end up anywhere in the world. And so it is an international concern.
So this priest who died, was that the case, that he wasn't exhibiting any of the symptoms, but by the time he was, it was too late, and God knows who he might have come in contact with?
Well, that's the problem. Because this is an under-resourced region, people basically don't have access to medical care. All of the hospitals shut down in Liberia, all the government hospitals. The only hospital that continued to function in Monrovia, a population of nearly 1 million people, was the SIM ELWA hospital, where the SIM missionaries recently returned. This is where Dr. Brantley was working.
Exactly. You know, Doctor, a lot of people look at this and they hear that, look, if those wearing hazmat suits can get this, now they weren't wearing hazmat suits 24/7, I understand, but that they got this. Who's to say that many other folks didn't as well, and they're just not exhibiting those symptoms right now, and it might be a matter of time before we start seeing more cases, not only in, in Liberia, but well outside that country, the other 3 countries affected, including Nigeria, and even away from the African continent. What do you think?
Well, I think that because we're aware of the outbreak, the CDC here in the United States, for example, has been in contact with all of the hospitals and doctors in this country so that should there be a passenger to come in and exhibit any symptoms, such as a fever, that person would immediately be quarantined so as not to come in contact with the general population, and then would be observed for that 21-day period, and should any symptoms develop, they would, of course, be treated.
Real quickly, Doctor, you think it's going to be a big problem here?
I have no way of knowing that, but I do know that there are people dying every single day. The death toll is likely to reach into the thousands. It's already past 1,000. And we need to, for humanitarian reasons, look at the people who are afflicted with this disease and have absolutely nowhere to go. So you have people, for example, that become infected and the hospitals are closed, and so they do the best they can. There are bodies that are in homes that have been abandoned. People are calling for the authorities to remove bodies that are staying for days. And so it has the potential to really ramp up and get counts into the tens of thousands. So I don't think we should take this with a grain of salt, but rather soberly, that this requires an international coming all hands on deck to see if we could try to stem the tide and break the chain of transmission of this deadly disease.
Doctor, thank you very much. We appreciate it.